Hey everyone, welcome back to the channel. Today we're diving into a comprehensive, honest, and super useful review of Otezla, also known as Apremilast. This video is for education and inspiration only, it's not medical advice. Be sure to consult a healthcare professional and double-check everything with trusted sources. Alright, let's get into it. So what exactly is Otezla? It's the brand name for Apremilast, an oral medication that belongs to a class called phosphodiesterase 4 inhibitors, also known as PDE4 for short. It's FDA-approved to treat psoriatic arthritis, moderate to severe, plaque psoriasis, and oral ulcers in Behçet's disease. Unlike injectables or biologics, Otezla is taken by mouth, which already gives it a unique place in the treatment toolbox. Now let's talk mechanism of action. Otezla works by inhibiting PDE4, which increases a molecule called CAMP inside your immune cells. That boost changes how your immune system behaves. It reduces pro-inflammatory cytokines like TNF-alpha, IL-17, and IL-23, and it boosts anti-inflammatory cytokines like IL-10. Translation: it tones down the overactive immune response we see in conditions like psoriasis and psoriatic arthritis. So who's a good candidate for Otezla? If you have psoriatic arthritis, especially with enthesitis or minimal joint swelling, if you have plaque psoriasis and want a treatment that isn't an injection, or if you struggle with oral ulcers from Behçet's disease. It's also great for people who prefer to avoid immunosuppressants or who have comorbidities that make biologics tricky. Let's walk through how to take Otezla. The full dose is 30 milligrams twice daily. But it's important to ramp up slowly over the first 5 days, as shown in the starter pack, to reduce gastrointestinal side effects like nausea and diarrhea. The titration schedule that I use for my patients looks like this. Day 1, 10 milligrams in the evening for 7 to 10 days. If no side effects, I will then follow the directions on the starter pack. In my experience, Otezla can be just as effective at lower doses as well, so lower doses can be used in case of side effects. If you have kidney issues, the dose needs to be reduced, so always talk to your doctor first. Now let's talk benefits. One of the biggest pros of Otezla is that it's oral. No needles and no infusions. No routine lab monitoring. You don't need regular blood work like you do with methotrexate or biologics. And there's no immunosuppression. That means no increased risk of serious infections or reactivation of tuberculosis or hepatitis. It's especially great for patients who want a lower risk option or who are nervous about biologics. But how effective is it? In psoriatic arthritis, Otezla showed improvement in joint pain and stiffness in the PALLAS 1-3 trials, especially for ACR20 response. For plaque psoriasis, the ESTEEM trials showed solid results. Many patients achieved PASI 75, which means a 75% improvement in skin symptoms. And for Behçet's disease, the RELIEF study showed fewer and less severe oral ulcers. In my experience, Otezla has also been very effective in treating sacroiliac pain that occurs in patients with psoriatic arthritis. Sacroiliac pain usually manifests as back and or buttock pain that gets worse with inactivity, such as sitting, standing, and laying, but it improves with activity such as walking or exercise. Patients with sacroiliac pain often have more pain and stiffness with sitting and have to reposition frequently. They tend to use standing desks at work because they cannot sit a long time. They also often toss and turn a lot at night, interrupting their sleep, making them fatigued and tired the next day. With Otezla, these patients can sit, stand, and lay longer without having to reposition frequently. Pretty impressive for a small molecule. Let's cover the side effects, because every medication has them. Most common are diarrhea, nausea, and headache, especially in the first couple of weeks. Usually manageable and short-lived. Some people notice weight loss, especially if they already have gastrointestinal symptoms. And in rare cases, mood changes, including depression or suicidal thoughts, have been reported. So it's super important to monitor mental health and bring up any concerns early. Be careful if you're taking CYP3A4 inducers like rifampin, carbamazepine, or phenytoin. These can lower Otezla's effectiveness. And again, dose adjustments are needed if you have kidney disease. Let's put it side by side with biologics. Otezla is taken orally while biologics require injection or infusion. No labs are required for Otezla, but biologics typically need regular monitoring. Otezla doesn't cause immunosuppression. Biologics do. Otezla has a slower onset of action. Biologics tend to work faster. The risk of infection is low with Otezla, but moderate with biologics. Both can be expensive, but support programs are available. So while Otezla may not work as quickly or strongly as some biologics, it brings a ton of convenience and safety to the table. Alright, so what's the bottom line? Otezla is a smart, flexible option for people with psoriasis, psoriatic arthritis, or Behçet's disease who want a non-immunosuppressive, needle-free, and lab-free treatment. It's especially great if you're navigating multiple conditions, need something well-tolerated, or simply want a lower-risk choice. That said, it's not for everyone. Like every treatment, it's about the right fit for the right person. So always partner with your rheumatologist or dermatologist to make the best call for you. If you found this helpful, don't forget to like, subscribe, and hit the bell for more deep dives on autoimmune health treatment strategies and patient-centered care. Have questions about Otezla or your experience with it? Drop a comment, I read every one. Thanks for watching, and I'll see you in the next one.